let's get down to it. COVID cases and the COVID crisis continues to be our top focus here on the India development debate. And today we're going to talk about what's going to happen from tomorrow. 1st May is a very important day, I would say a red letter date in India's fight back against COVID-19, because it's the day when all adults, everyone above the age of 18, is eligible to be vaccinated. Now, the question so far for the last several days has been, that's fine. Many people, crores of people have registered on the CoWIN portal. But where are the vaccines? Several states, in fact, as early as this evening have said that they will not be able to start the vaccination drive from tomorrow. Some states, including Gujarat and Maharashtra, have said they will start in small quantities and small phases. And private hospitals later this evening have come out with the information that they will be rolling out the vaccination drive in limited capacity. Among them are Apollo hospitals who we spoke with a little earlier this evening on ET Now. And we're now speaking with Abhay Soy, Chairman and Managing Director of Max Healthcare, that will also roll out the vaccination program from tomorrow. Mr. Soy, thank you so much for speaking with us here at ET Now. Can you give us details of in what capacity and to what extent the vaccine program will be rolled out tomorrow for everyone above 18 plus?
So we are rolling it out across all our centers tomorrow. The modus operandi is that one has to book their appointments through the CoWIN application. There are 4 slots, 2 before lunch and 2 after lunch. One can, lunchtime, one can book their appointments. There are no walk-ins, that is as per instructions and regulations. So one has to book their appointments on the CoWIN app at any of the Max centers, and we would be vaccinating them with Covishield from the Serum Institute of India.
Okay, so only Covishield from tomorrow. What is the per day sort of vaccine target that you have, Mr. Soy, starting from the 1st of May? You talked about 4 appointments, but how many per day across all centers?
We can do about 8 to 10,000 a day vaccinations, and we will be reaching out to the state government as well. As as you're aware, most of our hospitals are in Delhi NCR, and this is one of the most impacted areas. It is ground zero as far as COVID is concerned. So we would also be reaching out to the state governments and perhaps doing it from schools, which are empty, which seem to be perfect grounds for us to do vaccinations. That coupled with off-site vaccinations with corporates at their locations and so on, I think we have the capacity of going up to about 3 lakh to 3.5 lakh vaccines a month.
Wow. So, Mr. Soy, can you give us details? You mentioned that you're starting off with Covishield only. What would the pricing be for the person walking in to get vaccinated tomorrow onwards?
So the price breakup essentially is we are procuring it at 600 rupees a vaccine, a dose. There's about a 50-odd rupee GST on top. You typically have a 4 to 5%, let's say, wastage, which is another 30-odd rupees. 15-odd to 20 rupees is cold storage and freight charges that we pay for transportation as well as supply chain of the cold storage of the vaccine. On top of that, we will be looking at charging an administrating fee of about 2 to 250 rupees. So I think net it will be anything between 8 to 900 rupees that we're looking at doing this.
Okay, so 8 to 900 rupees per dose of Covishield at Max Healthcare from tomorrow. Can you share with us, Mr. Soy, what is the amount of vaccines that you have at this point, procured at this point, and how long that can last? You've said you can vaccinate up to 3 lakh a month in total. So how many doses do you have at this point? Because vaccines are in really short supply.
We have a few lakh doses. It should last us for some time as we sort of ramp up. And I'm hoping by then, in the midst of this, we'll be able to augment it with further supplies as well. From here, it needs to be, we need to do whatever we can to be able to procure these, augment the national vaccination program, and play a small but very significant part in rolling this out.
Yes. Mr. Soy, can you share with us if there are other manufacturers that you're in conversation with? You've talked about Covishield, but are you in talks with Sputnik, for example, or any of the vaccines produced globally, which now, as per the new vaccine program, private hospitals like yourself can procure from?
Let me put it this way. There isn't any manufacturer of vaccines that we are not in touch with. So we are in touch with perhaps each one of them. There are certain restrictions. Certain vaccine manufacturers like Pfizer and Moderna have gone on record to say that they will only be selling to governments. They will not be providing it to private players. So, we have been in touch with them, in talks with them, and perhaps, if a channel opens up where the government procures or we procure through government channels, that is something which will work very well. Of course, that is something which is going to be aimed at perhaps the higher socioeconomic strata, because the Pfizer vaccine, the Moderna vaccines are more expensive than what is being produced in India in terms of both Covishield and Covaxin.
Mr. Soy, since I have the opportunity to speak to you right now, and considering, as you mentioned, that Delhi is the epicenter of the COVID crisis in the country, I want to get a sense from you on what the current situation is. Firstly, and most importantly, are oxygen needs being met, or is there still a panic as far as oxygen shortages are concerned?
So, look, we have been facing a pandemic which is, it's been extremely steep climb. Our oxygen requirements typically, 10 to 15% of people in hospitals used to be on oxygen. Now it's 85 to 90%. And the utilization of oxygen has also gone up dramatically. So, typically the requirement of oxygen has gone up to 4 to 5 times. That's one. Second is, whilst oxygen deliveries used to be once every 2 days, in order to meet this higher requirement and lower storage capacities all across, these are being done twice a day. So it's pretty much just in time. And when you have this sort of situation, and every state, every city around looking at enhanced oxygen needs, that is what sort of causes confusion, causes certain situations which perhaps should not happen, disruption of supply chains and so on. So we've been facing an extremely challenging time in terms of supply of oxygen. But I am assured by many that today onwards it is something which is going to improve, and hopefully we'll be able to sleep this one night in the last 8 nights that we haven't.
Mr. Soy, we're still seeing heart-wrenching scenes and hearing about people waiting to get beds, waiting to get oxygen cylinders. Do you see that pressure easing anytime soon? Are patients still struggling to get beds? Are there any available beds in your hospitals?
Look, I think the challenge is not only beds, but the sort of beds, and the challenge is all across. First and foremost, hospitals are in some manner prevented from enhancing capacity, because for every patient you require oxygen. For every patient requires about 16 odd liters of oxygen, a COVID patient. So it's directly related to perhaps, what is the sort of oxygen supply that you have. So that is the first, place that a hospital is hamstrung in its ability to take on more and more patients, even if they could. So that's one. Second is that, there are a lot of people who are getting very critical, a lot of people who are getting very infected. Each one, perhaps every family that each one of us knows, somebody or the other in that family has been infected. So you can imagine the deluge of patients is there in Delhi NCR particularly. And what we're seeing is that, look, even if they make their way to the hospitals, once they are on oxygenated beds, whatever amount you can make available simply because you have a limitation in terms of oxygen supply, the next course is when these people or patients in oxygenated beds, they sort of become for the worse. They require ICU beds. That's another set of challenges. because ICU beds are occupied and they're overflowing. Within the ICU, there is a shortage of ventilators because every ICU bed does not have a ventilator. So there are many claimants for the ventilators and BiPAPs, for ECMO machines, and so on and so forth as the disease progresses. So you're seeing this, I'm afraid that we'll perhaps see a lot more criticality over the next 10 days, simply because these are people who gotten infected about 10 or 15 days ago. Usually the virus itself has a life cycle where after 10 or 15 days is where people become critical, right? So you're going to see a lot more criticality and a lot more situations, morbid situations going forward, I think, over the next 8 to 10 days. But I do believe the positivity numbers have been sort of plateauing and coming down a little bit. So that's perhaps the only silver lining, that this situation is not going to be lasting forever. And, we continue with the lockdown. Maharashtra is a great example where there has been a lockdown and you've seen a dramatic reduction in positivity. And I'm certainly hoping we do that very, very quickly in Delhi NCR, because Delhi, you must keep in mind, doesn't only bear the load for Delhi. Delhi bears the load for entire North India, Northeast India, a lot of Central India as well. So there are a lot of people from neighboring states who are coming down. And, of course, there is a shortage of healthcare facilities in tier 2, tier 3 cities. So you can imagine what's happening.
Just last question, Mr. Soy, and I really want to thank you for taking out the time to speak with us when you are firefighting on so many fronts. We really appreciate it. But, the country is seized with what Delhi and Delhi hospitals are going to. It's in the courts as well. From your end, as a care provider at this time, what do you require? If you were to put out a list of things that you need urgently to be able to save lives, what would they be?
I think supply lines. I think first and foremost, supply lines. We need adequate oxygen. We believe we can all expand capacities. In fact, we can take more and more patients. We can serve more and more people, save more and more lives. But we are constrained. We are limited to doing that because, look, even our current oxygen requirements are sort of not being entirely met, and that is something which needs to be put in place. Once that is done, we'll be able to take even more critical patients. Just to give you an example, a patient on an oxygenated bed, if he requires 1x of oxygen, a patient in a ICU requires 3 times that. And the need of the hour today is to convert more and more oxygenated beds into high dependency units, into critical care units, to use ventilators, use BiPAPs, use ECMO machines, which are oxygen guzzlers. But the fact is, that is what is going to save lives as the situation progresses going forward. So I think first and foremost is that. Secondly, as far as manpower is concerned, resources are concerned, there are plenty at this point of time. That is obviously going to be running short. But, of course, we can kind of dilute the sort of quality, so to say, of care in order to reach out to more and more people. So in ICU, if it's typically a 1-to-1 nursing, which is the standard pre-COVID times, you can really take it down to 3 or 4 times, because a pandemic is akin to a war, right? Effectively, you try to save as many lives, and if you have to work harder for it, we're all doing that. I say this for perhaps each and every healthcare worker right now. They are exhausted, working overtime. The letdown is perhaps the supply chains, which we need to get in place, because it's heart-wrenching. Everybody's trying to do their best in the healthcare system, but the supply lines need to hold up.
Thank you so much, Mr. Soy, and salutations to all the healthcare workers out there who truly are our saviors, working through the toughest of conditions at this time. Thank you for taking out the time to speak with us. Abhay Soy, they're of Max Healthcare, talking about what hospitals in Delhi need. He's also outlined what Max Healthcare will be doing as part of the vaccination rollout tomorrow, which starts from the 1st of May. Max, Apollo and Fortis are the 3 private hospitals that we've learnt out of so far, which will be giving out the vaccine, but only if you've registered on the CoWIN portal. They are not entertaining walk-ins. Walk-ins have not been allowed. All governments have said they do not want people to crowd up outside hospitals. That would be the last thing you need in the middle of a pandemic.